Okay, your time is now 6:19. Ovarian cancer is one of the most common cancers among women in the U.S., and yet it is still very difficult to detect.
Up next in today's Morning Medicine, I'll let you know about some of the warning signs that could help detect this disease in an earlier stage. We're back in a couple minutes.
On the medical front this morning, September is Ovarian Cancer Awareness Month, a time to increase knowledge about the 8th most common cancer among women in the United States.
It's often called the silent killer because ovarian cancer often develops without clear warning signs. Current testing to detect it, not very reliable, but researchers are working towards some new approaches that may offer hope.
Last year, at the age of 34, Sylvia Burke was hit with a devastating diagnosis.
The doctor told me I had cancer, ovarian cancer. Of course, I freaked out.
The Ovarian Cancer National Alliance estimates that nearly 22,000 American women will be diagnosed with ovarian cancer this year. Over 15,000 will die from this disease.
If we discover ovarian cancer when it is confined to the ovaries, the 5-year survival or cure rates in excess of 90%. But once it escapes beyond the ovaries, and there are different stages there, you are really talking about 50 and 40 and 30%.
Dr. Atif Hussain says ovarian cancer is often discovered in the late stages of the disease because the warning signs are very nonspecific. Symptoms may include, but are not limited to, bloating, urinary urgency or frequency, pelvic or abdominal pain, and indigestion.
We cannot tell women to go and be examined for ovarian cancer every time they have indigestion, discomfort in the lower abdomen or in the pelvis. Unfortunately, that's the tricky aspect of this disease.
Another problem is the current lack of reliable screening tests. Dr. Hussain says those on the market today often lead to false positive or false negative results. But researchers are working on a test right now to be able to track blood proteins that are markers for ovarian cancer.
What this test tells us, a pattern, a signal, a change in the protein in the blood that could correlate to early stages of ovarian cancer for that specific woman.
Fortunately, Sylvia Burke's cancer was caught early. Though she has now lost her dream of having children, she still has hopes for the future.
I'm looking forward to life, enjoying life every day.
And while ovarian cancer can strike really at any age, the majority of women, approximately 87%, are over the age of 45. Although Pap tests do not detect for ovarian cancer, it's really important to have that annual OBGYN exam to check for any possible changes.